Hello everyone, my name is John. Welcome back to the channel. Now today, we're going to be taking a look at one of the most prominent experts in nutrition in the world. And her name is Dr. Marion Nestle. And she has a degree in molecular biology. And she spent years in the USDA's Department of Health and Human Services. And she's just an incredible expert in nutrition. And she has some very good insights, very interesting insights, and they're easy to digest, they're easy to understand. But she has one philosophy that I think you'll find interesting, and we're going to take a look at it in this video, so stick around. Dr. Marion Nestle has a PhD in molecular biology. She spent years working inside the U.S. Department of Health and Human Services helping develop dietary guidelines. She's authored multiple books on food politics and nutrition policy. She taught nutrition at New York University for decades. If anyone understands the science, the politics, and the complexity of nutrition advice, it's Marion Nestle. So what does she personally eat? Her philosophy is breathtakingly simple. Don't eat anything you can't make in your own kitchen because you don't have the machinery or access to the ingredients to make it. That's it. No complicated macronutrient ratios, no calorie counting, no food pyramids or plates divided into color-coded sections. Just one question: can I make this at home? If the answer is no, she doesn't eat it. In a 2024 interview, Nestle used Doritos as her example. You cannot make Doritos in your kitchen. You don't have the industrial machinery to extrude corn into that specific shape. You don't have access to the proprietary flavor chemicals that create that particular taste. You can't replicate the exact combination of additives that give Doritos their shelf stability, color, and texture. Doritos require a factory. They require ingredients that aren't available to consumers. They require processes that can't be duplicated at home. By Nestle's standard, that disqualifies them as food she'll eat. This isn't about Doritos specifically. It's about the entire category of ultra-processed foods that dominate American diets. Foods engineered in laboratories, manufactured in industrial facilities, and formulated with ingredients you've never heard of and can't buy. The woman who helped write the federal nutrition policy doesn't trust those foods, and she has very good reasons why. The concept of ultra-processed foods comes from Brazilian researcher Carlos Monteiro, who developed the Nova food classification system. It divides foods into 4 categories based on processing level. Ultra-processed foods, category 4, are industrial formulations made primarily from substances extracted from foods or synthesized in laboratories. They contain ingredients you don't have in your pantry and can't buy in stores. Hydrolyzed proteins, modified starches, hydrogenated oils, flavor enhancers, colorants, emulsifiers, and other additives. Most importantly, they're designed to be hyperpalatable. Food scientists deliberately engineer them to be irresistibly delicious. The goal is that you can't stop eating once you start. Remember the old Lay's potato chip slogan, "Bet you can't eat just one." That wasn't a joke. That was the objective. Nestle's kitchen rule is essentially asking, is this ultra-processed? If yes, avoid it. She's not advocating for any particular diet. She's not anti-carb or pro-keto. In an interview, she acknowledged that people have different dietary needs and preferences. Her emphasis is on the degree of processing, not on whether you're eating plant or animal foods, high carb or low carb. Nestle's personal rule is supported by a growing body of research linking ultra-processed food consumption to negative health outcomes. Over the past decade, hundreds of studies have consistently found associations between higher intake of ultra-processed foods and increased risk of obesity, type 2 diabetes, cardiovascular disease, cancer, and premature mortality. While most of this evidence comes from observational studies showing correlation rather than direct causation, the consistency and scale of the findings have raised serious public health concern. And we have one landmark experimental study that provides causal evidence. Researcher Kevin Hall at the National Institutes of Health conducted a randomized controlled trial where participants lived in a metabolic ward for a month. For 2 weeks, they ate an ultra-processed diet. For 2 weeks, they ate a minimally processed diet. The calories, macronutrients, sugar, fat, fiber, and sodium were matched between the 2 diets. The participants ate 500 more calories per day on the ultra-processed diet. They didn't realize it. They weren't trying to overeat. The food just made them eat more. In 2 weeks on the ultra-processed diet, participants gained an average of 2 pounds. In 2 weeks on the minimally processed diet, they lost 2 pounds. This wasn't about willpower. This wasn't about personal responsibility. This was about the food itself driving overconsumption in ways that people couldn't consciously detect or control. Kevin Hall, the researcher, went into the study skeptical. He thought the idea that processing mattered was overblown. The results shocked him. Marion Nestle has been saying this for years. Ultra-processed foods are engineered to make you eat more. That's their purpose. Food companies aren't trying to nourish you. They're trying to maximize consumption and profits. One former food industry scientist turned whistleblower revealed the objective. He said the objective is to get you to buy the product, then use the product, and use the product, and use the product, and feel almost like you're addicted to it. This is the bliss point, the exact combination of salt, fat, and sugar that maxes out your brain's pleasure receptors. It's not an accident. It's a calculated formula designed in labs to bypass your brain's natural fullness cues. As one former CEO of Nestle admitted, their products are engineered for irresistibility. The goal is to make willpower irrelevant. Goal is to just make you want their product over and over and over again, because the more you purchase that product, the more money they make, and they max out their profits. And here's the thing about that. Your health is not in the equation. It's all about profits. From Nestle's perspective, the official dietary guidelines are long and convoluted, partly because they're shaped by political compromise, written to avoid conflict with powerful agricultural interests. Most doctors don't read them. Even nutrition professionals struggle to translate them into practical advice. Nestle's personal guideline fits in one sentence. Don't eat what you can't make in your kitchen. One is useful. Nestle's simple advice. One isn't the American dietary guidelines. She points out that nutrition advice could be summarized in 7 words, a phrase popularized by food writer Michael Pollan. Eat food, not too much, mostly plants. By food, Pollan means real food, relatively unprocessed. The stuff Nestle would say you can make in your kitchen. Not too much means portion control and calorie balance. Mostly plants means fruits, vegetables, grains, beans, with some animal products if you choose. That's it. That's all the dietary guidance most people need. Everything else is complexity introduced by industry interest, political compromise, and institutional bureaucracy. The dietary guidelines are long and complicated because they're designed not to offend agricultural industries. They can't say eat less meat because the meat industry lobbies against it. They can't say avoid processed foods because food manufacturers lobby against it. They can't prioritize public health over industry profits because the USDA's dual mandate requires promoting agricultural products while also providing nutrition advice to consumers. So we get lengthy, nutrient-focused, food-agnostic recommendations that allow food companies to game the system by adjusting individual nutrients while keeping their products fundamentally unhealthy. Nestle knows this. She watched it happen. She participated in the process. And her personal response is to ignore the complexity and follow a simple, practical rule that actually works. One criticism of Nestle's rule is that it's privileged. Not everyone has time to cook from scratch. Not everyone has access to fresh, whole ingredients. Not everyone can afford them. Nestle acknowledges this, but she also points out that the food industry deliberately targets low-income communities with ultra-processed products and predatory marketing. The solution isn't to accept that poor people should eat garbage. The solution is systemic change, better food access, fair wages, stricter marketing regulations, and food assistance programs that prioritize real food over processed products. You don't need to follow Marion Nestle's exact philosophy, but her kitchen rule provides a useful filter. When you're deciding what to eat, ask, could I make this at home with ingredients I can buy and tools I have access to? If yes, it's probably fine. If not, it's worth questioning whether that food serves your health or primarily serves a corporation's profit motive. The woman who helped write America's dietary guidelines doesn't follow them. She follows one rule based on common sense and decades of expertise. If you can't make it in your kitchen, it probably shouldn't be in your body. Maybe that tells you everything you need to know about whose interests those complex guidelines actually serve. Now, before we end, I just want to point this out. Here's one of the things about Dr. Nestle that I find interesting. And I'm really into her work, her speeches, listening to her insight. She's extremely knowledgeable. And she puts things in very simple terms. And the depth of her knowledge is just breathtaking because of her years of experience. But here's the thing about it. She helped formulate the dietary guidelines. However, she doesn't follow them because the dietary guidelines has a lot of the main section, the foundation of the dietary guidelines is a lot of processed foods. She don't eat processed foods. And the thing about that is this, for me, if someone with her level of experience who helped formulate the dietary guidelines don't follow them, that in and of itself is a wait a minute moment. But that's just me. So I hope you got value out of this video. Don't forget to like and to share and subscribe to my channel. Thank you for watching. We will see you in the next video. I'm out.